Welcome to the Deep Dive. Today we're taking a close look at something uh, incredibly important.
Yes.
Based on the articles and, the information you've sent us, it seems like it's something often experienced in silence.
That's right.
We're talking about understanding and seeking care for postpartum depression.
Mm-hmm.
So if you're listening right now, maybe those first few months after having a baby,
Yeah.
and you're finding that the joy you sort of expected feels distant,
Yeah.
maybe replaced by just overwhelm or sadness, anger, even feeling disconnected.
It happens.
We want to say this directly to you. You are absolutely not broken. You're not failing.
Not at all.
Our mission here in this deep dive is really to help you understand what postpartum depression is based on what you've shared.
And make it really clear.
And just to know that support is available without any judgment.
Yeah.
None at all.
Exactly. We want this deep dive to hopefully offer a clearer picture of postpartum depression, go a bit deeper than the surface.
Mm-hmm.
And crucially, just reassure you that reaching out, asking for support, that's a sign of strength.
Yeah.
And it's definitely available.
Okay, so let's unpack this right away.
Yeah.
Because one of the first things that seems really key from the sources is telling the difference between the baby blues and actual postpartum depression. They can get mixed up, can't they?
Oh, easily. And it's a really key point. Many, many new mothers have some mood changes right after birth.
Like in the first few days.
Yeah, exactly. You might feel tearful, maybe a bit irritable, anxious.
Okay.
That's often what we call the baby blues. And generally, those feelings, they tend to ease up pretty quickly.
Within like a week or two?
Usually, yeah. Within a week, maybe two, they resolve on their own.
So when we talk about postpartum depression then, what really sets it apart? What should someone be looking out for that signals it's, well, more than the baby blues?
Postpartum depression, it goes much deeper, and it lasts much longer.
Okay.
We're talking about feelings that are persistent, that really get in the way of your day-to-day life.
How you function.
Right. Your ability to care for yourself and for your baby. You might feel this deep, ongoing sadness, maybe lose interest in things you used to enjoy. Big changes in appetite, maybe sleeping way too much or hardly at all, feeling exhausted all the time.
That crushing fatigue.
Exactly. Feelings of worthlessness or guilt that doesn't make sense, trouble concentrating.
Right.
And in some serious cases, even thoughts of harming yourself or the baby.
And that feeling you mentioned earlier, being disconnected from the baby.
Yeah.
I saw that in one of the articles too. That must be particularly upsetting.
Oh, absolutely.
Because there's this huge expectation, right, inside and out, that you'll just instantly bond.
Precisely. And it's not uncommon for women with PPD to feel distant, emotionally distant from their baby.
Yeah.
And like you said, that is incredibly distressing. It can bring up so much guilt, so much shame. You might also just find yourself crying. You don't even know why, or feeling like you've lost yourself somehow.
Okay. This is where looking at some of the personal stories you shared gets really interesting. Despite how common this seems, so many people feel like they just can't talk about it. What are the hurdles? What stops new mothers from getting help?
Well, there are quite a few significant factors, unfortunately. There's still a big stigma around mental health generally.
Yeah.
And that can feel even bigger, kind of amplified when it comes to being a new mother.
Because of the expectations.
Exactly. Society paints this picture, doesn't it? Motherhood as just perfectly joyful, this ideal.
Right, the Instagram version.
Kind of, yeah. And when your reality doesn't match that picture, it can feel like you're failing personally. So you might worry about being judged or someone calling you a bad mother, or even, fear that Child Protective Services might get involved, which is usually not the reality, but the fear is real.
And I can easily imagine how, even well-meaning friends or family might accidentally make it worse by saying things like, oh, it's just your hormones acting up, or you'll bounce back soon.
Yes. That's a really important point to bring up. Well, the huge hormonal shifts after birth, they definitely play a role.
Sure.
But postpartum depression is more complex than that. It's a mix of biological factors, psychological ones, social pressures.
It's multifaceted.
Right. So just dismissing it as hormones invalidates what someone is actually going through as real suffering.
And it stops them asking for help.
It absolutely can discourage them from getting the support they genuinely need.
So, okay, for you listening right now, maybe recognizing some of this in yourself as we're talking, what support is actually out there? What are the ways to feel better that the sources highlight?
Well, the really encouraging news is that postpartum depression is absolutely treatable.
That's key.
It really is. The first step, the crucial one, is just acknowledging that what you're feeling is real, it's valid, and understanding that asking for help, that shows strength. It shows self-awareness. It's not weakness.
Not at all.
And there are several really effective treatment options available.
Okay, let's dive into those a bit more then. What kind of professional help is usually, like, the first step?
Therapy is often a cornerstone, especially therapy with a mental health professional who really gets postpartum mental health, someone trained in it.
Specialized help.
Exactly. Different kinds of therapy like cognitive behavioral therapy, CBT, or interpersonal therapy, IPT, they can be really helpful.
How do they help?
Well, they help you sort of identify and manage those negative thought patterns, learn good coping strategies, and maybe strengthen your support network too.
Okay. And what about medication? I know from some of the questions we got beforehand that this is a big worry for new moms, especially if they're breastfeeding.
Totally understandable concern. Medication can be a really valuable tool for managing PPD symptoms.
Right.
And the good news is there are many antidepressants that are considered safe to use while breastfeeding.
Okay, that's reassuring.
It is. But it's a decision that needs to be made really carefully, talking closely with a doctor.
Of course.
They can assess your specific needs, weigh up the risks and benefits for you, and help find the right medication, the right dose. It's very individual.
Are there other things maybe more focused on lifestyle, well-being, things that can help support recovery?
Oh, absolutely. Things like bringing in some gentle routines, things aimed at helping regulate your nervous system, that can make a real difference.
Like what sort of things?
Well, prioritizing sleep hygiene as much as you realistically can with a newborn, obviously.
Yeah, that's the tricky part.
It is. But doing what you can. Also, maybe incorporating some light physical activity when you feel up to it. Getting outside, getting some sunlight.
Nature helps.
It really can. And connecting with other mothers. Support groups, whether they're online or in person, like one article mentioned, can be just invaluable.
That sense of community.
Yes,
Yeah.
that feeling of not being alone in it, that's powerful.
So it sounds like there's quite a range of support options available. You can kind of tailor it to what you need.
Exactly right. And what's really interesting from the research is that often it's a combination. Therapy, maybe medication, if it's right for you, plus these supportive lifestyle things. That mix can often be the most effective way to manage PPD and, get back to feeling well.
Okay. So let's bring it right back to you, the listener. If anything we've talked about today is resonating, if you're questioning how you're feeling, please truly know this. Reaching out for support is an act of incredible strength.
It really is.
It's that very first step towards feeling more like yourself again.
And if we think about the bigger picture here, seeing postpartum depression not as some kind of personal failing, but as a health condition.
Like any other health condition.
Exactly.
Yeah.
One that needs understanding and support. That perspective is so crucial.
Why is that so important?
Because it allows people like you listening to seek help without feeling ashamed. It opens the door to getting effective treatment, to recovery, which ultimately helps not just the mother, but the whole family. And it kind of raises a question for all of us, doesn't it? How can we, as a wider community, create environments that are more supportive, more understanding for new parents generally?
That's definitely something important for everyone to think about. Thank you so much for sharing all this expertise and walking us through such a vital topic.
It was my pleasure.
So as we wrap up this deep dive into understanding and seeking help for postpartum depression, let's just say it again, one more time, directly to you. Postpartum depression is real.
It is.
It is treatable. And it is absolutely not a sign of weakness.
Not even close.
In fact, recognizing it and then actively reaching out for help, that's a really powerful act for yourself and for your child.
And remember, those resources are there. Therapy with professionals who specialize in postpartum mental health, they can offer real support and guidance. Medication can be safe. It can be effective when it's needed, even if you're breastfeeding.
Right.
And bringing in those gentle routines, sleep when you can, light movement, some sunshine that can really help regulate things.
And the support groups.
Definitely don't underestimate connecting with others. Online, in your community, finding that shared experience helps so much.
We really do understand that asking for help can feel incredibly hard.
Especially when you're feeling vulnerable.
Exactly, or uncertain. But honestly, the fact that you've even taken this time just to listen to this information today That shows real strength.
It really does.
It shows a commitment to your own well-being. And you should genuinely feel good about that. Speaking up, reaching out, that's a strong, positive first step.
It's the start of the path towards healing. For you and for your baby, too.
Which brings us to maybe a final thought for you to consider. Maybe sometime today, just take a quiet moment. No pressure, no judgment at all. Just check in. How are you really feeling?
Acknowledge those emotions, whatever they might be.
Yeah. And please just remember this, above all, you are not alone in this experience. Support is out there.
It is available. And reaching out for it, that's a sign of strength. It's a real step towards hope.